So in this third PowerPoint, we're going to go over some of the names, or the names of some muscles, and where they're located and their function, and get a better sense of how muscles operate on a more macro level. So the first slideshow we were looking at the microscopic function of muscles, so now we will look at the macroscopic function of muscles. So when we look at muscles, one key thing to think about is their origin and insertion. So up here you're looking at the biceps, and you can see that the origin is up at the top in the shoulder region, and the insertion is in the forearm. And we talked about with the skeletal system how muscles are helping us to move our body, and so they often will cross over a joint to perform that lever action for the bones. So in this case, the bicep brachii is crossing over that elbow joint and inserting into the forearm, so that when the muscle contracts, and when a muscle contracts, it shortens. So if you look at this picture and you think about this bicep brachii muscle shortening, you can imagine that when this muscle shortens, it's going to sort of pull on the forearm, and that's what allows you to bend at your elbow. So again, there's a few different things happening here. You have, when you contract your bicep brachii, your arm is bending at the elbow, but the muscle is inserting into your forearm, and so pulling your forearm up, and that's why you get the bend in your elbow. But with each muscle, part of the reason that we looked at all these bony landmarks is that each muscle has a point where it of its origin and a point of insertion, and oftentimes these points are on bony landmarks, which is why we looked at all those bony landmarks in lab, so that we have a better sense of where they're actually starting and ending. So oftentimes the origin of the muscle will be more proximal or superior, and oftentimes the insertion point will be more distal or inferior. But the technical definition of the origin versus the insertion is that the insertion is going to be the more movable end, and the origin is going to stay where it is. So again, if you look at this bicep brachii muscle and you think about contracting it, the shoulder area where the origin is not going to move, but the elbow joint is going to have movement. So the insertion point of the bicep brachii will move, and that's why it's the insertion and it's not the origin. Okay, I think that's a key point here. Okay, so when we are dealing with skeletal muscle movement, there's some more key terms that you need to become familiar with. So the agonist is the prime mover, the one doing the majority of the work. So again, if you were doing some bicep curls, the bicep brachii would be the prime mover, the agonist in that exercise. Versus a synergist, which is a muscle that's helping the agonist, but it's not the primary one. So for example, the deltoid muscle would actually be helping out, or the brachialis muscle. So there's several muscles. If you're doing bicep curls, that would be working, but they're not the primary muscle doing the bicep curl. The primary muscle doing the bicep curl would be the bicep brachii. The antagonist is the muscle opposing the agonist. So in the case of doing bicep curls, the antagonist would be the triceps, and this is a pretty good example because we're pretty familiar with the bicep versus the tricep. So the tricep is, right behind, posterior to the biceps. And again, it's the muscle that's going to antagonize the biceps. So, this is sort of serving several functions, but the antagonist can sometimes help prevent the agonist from getting carried away. So in other words, when you're doing biceps curls, the tricep is actually maintaining a certain level of tone, so your bicep doesn't doesn't get doesn't get so excited that it injures itself. The tricep is sort of helping it to pace itself in a way. So that's one function of the antagonist. You can also think if you're doing a bunch of bicep curls, after you do the bicep curl, often it feels good and it helps your body to stretch out that muscle, the bicep, by contracting the antagonist, in this case the tricep. But you want to keep in mind that when we're talking about an agonist versus an antagonist, those terms are going to be different depending on what type of exercise we're doing. Okay, so if we're doing an exercise to work our triceps, well then suddenly the tricep becomes the agonist and the bicep becomes the antagonist. Okay, so these terms are going to refer to different muscles depending on what the activity is. So that's what that says. So in terms of naming muscles, there's lots of muscles with different names, but if we think about some commonalities among them, it becomes easier to understand their names. So names of muscles can include the following characteristics: their function, their location, their size, and their orientation. So, as you start to learn the muscles, you'll see that some of the names, there's similarities, or that some of the names do make quite a bit of sense. So, for example, that first one should say pectoralis with an S, not a Z. But with the pectoralis major muscle, so the pectoralis major muscle is in the pectoral region of the body. In your first lab practical, there was a tape asking what region of the body is this, and the answer was pectoral. So, and we haven't learned the name of the muscles yet, and most people are pretty familiar with where your pecs are, your pectoralis major and your pectoralis minor. But again, that name of the region is the location, and so the muscles in that area are being named after the location. The orbicularis oris, so this is a muscle that goes around your mouth. So orbicularis basically means like orbiting your mouth, like going around, and oris means you're like as if it's referring to your oral cavity. So sometimes these names are coming from the Latin or Greek roots, so it doesn't necessarily help you, but that is why orbicularis oris is named orbicularis oris, because it's going around your oral cavity. And then flexor digitorum superficialis. So flexor digitorum superficialis is in your forearm. There are a lot of muscles in your forearm that are going to help you move your fingers. So sometimes learning all those muscles can be really challenging. But again, this name is helping us to make sense of this muscle. So it's flexor, meaning it's going to flex the fingers. Digitorum, meaning it's flexing your fingers. Digitorum referring to your digits. And then superficialis, meaning it's going to be more superficial than some of the other muscles. So flexor digitorum superficialis is really helping us to get a sense of its function. And that name is pretty helpful in understanding what that muscle does, even before we see the muscle. Okay, so we're going to go through these slides. I'm going to read you the names of all these muscles so you have some familiarity with how they are pronounced. When I dragged over the images, the image with the muscles labeled did not come all together. So in the next slide, you'll see the image with the muscles labeled. At the end of this PowerPoint and in your book are tables with the muscle names, the origin, insertion, and the function of those muscles. I'm going to ask you to focus on the names and locations of a bunch of muscles which are listed at the end of this PowerPoint, but I'll try to focus on those as we go through these images. And then I am only going to ask you to learn the origin and insertion of a few muscles. Memorizing all that information is certainly challenging, so I don't expect you to know the origin and insertion of all the muscles. If you study anatomy and physiology further, you may have to at some point. But so just to give you sort of a sense of, understanding the origin and insertion, I am going to ask you to memorize the origin and insertion of just a few muscles. So you'll see those start at the end. So let's just go ahead and go over the names of some of these muscles. So in the face, all the muscles that help you to control expressions of your face, we have the epicranius, the orbicularis oculi, orbicularis oris, the buccinator, zygomaticus, and platysma. And again, you'll see these labeled in the next slide. But in terms of the ones that I want you to focus on, I want you to, actually the two of them are in the next slide. So in this slide, I want you to focus on the epicranius is actually made up of two muscles, and one of them is the frontalis muscle. So the epicranius is actually, that muscle is actually two muscles. And one of them is the frontalis. And the frontalis is right on your forehead. So if you look at this image, that smooth layer of muscle in the person's forehead, that is your frontalis muscle. So you can, if you're touching your forehead, you are touching your frontalis muscle. If you furrow your eyebrows, you're contracting your frontalis muscle. So that's the first one I want you to focus on. Your masseter and your temporalis muscle, I'm also asking you to understand the function of and the location of. So with your masseter, if you put your hand on your cheek but towards your ear, and then you bite down or pretend you're chewing, you're going to feel that masseter muscle contract, pop out. With your temporalis, if you put your hand on your head in your temporal region right above your ear, and then you bite down again, you're going to feel that temporalis muscle pop out. So those are two that I want you to know the locations of. And here are all those muscles labeled. Okay, so again, the names, some of the names definitely make more sense than other ones, but we talked about orbicularis oris, and you can tell that orbicularis oculi, the naming pattern there is quite similar because that muscle is also orbiting, in this case, the eye. And then the zygomaticus, you can see how it's connecting from its point of origin is the zygomatic arch. So that name also makes sense. Okay, so muscles that move the head. So these muscles are in the neck. They allow you to move your head. Your sternocleidomastoid, your splenius capitis, and your semispinalis capitis. So I do want you to focus on your sternocleidomastoid. That's one of the biggest muscles in your neck. So if you put your hand on your neck, but sort of right below your earlobe, and if you're facing forward and then you turn your head to the right, so what you should do is put your hand on your neck on the left-hand side, right below your earlobe, and then turn your head to the right. And some people have very strong sternocleidomastoid, so it would pop out a bit, but mine certainly does not pop out, but you can feel it sort of becoming a bit taut. So if you are facing forward and you're palpating your sternocleidomastoid on the left-hand side of your neck, and then you turn your head to the right, you'll feel that muscle, become more prominent. So that's your sternocleidomastoid. And here's the diagram of your splenius capitis and your semispinalis capitis. But in this picture, I want you to also focus on your scalenes. That's another muscle that I'm asking you to focus on, which I guess it didn't get on the list, although it should have. It's also helping you to move your neck. So your scalenes, if you sort of feel in your neck down towards the bottom of your neck, you know, if you have sort of muscle tension in your neck and you sort of rub along towards the bottom but posterior side of your neck, sometimes you'll sort of feel what, or almost sometimes we refer to them as guitar strings because they're pretty skinny, but you know, if you carry tension in your neck, your scalenes also often get tense, and so you can feel them sort of popping out there. So muscles that move the pectoral girdle. Remember that the pectoral girdle is made up of your scapula and your clavicle. So these muscles are the trapezius, your rhomboid major, your levator scapulae, your serratus anterior, and your pectoralis minor. So again, levator scapulae, what a great name to just show us what the muscle is doing. It's levitating or pulling up on the scapula. So here are those muscles labeled, and I definitely want you to know your trapezius because it's one of your largest muscles in your body, as well as your latissimus dorsi. But I want you to look on the right hand side of the picture here. Again, muscles that are helping to move the pectoral girdle are going to be located on and around the scapula. So you can see your levator scapula there, connecting from your vertebrae down to your scapula. So again, you can imagine that if it contracts or shortens, it's going to pull up on your scapula. Your rotator cuff muscles, just as an FYI, are these muscles right below the levator scapula, your supraspinatus, your infraspinatus, your teres minor and major. Now the supraspinatus and infraspinatus, see how the word sort of has spine in it? So what those names are referring to, your supraspinatus is superior, or above the spine of the scapula, whereas your infraspinatus is inferior to the spine of the scapula. And we can also see the deltoid muscle here on the left hand side. The deltoid is a really cool muscle because it sort of covers the shoulder area. Its main function is to abduct the arm, but it also, as we talked about with synergist, it also actually can help to flex or extend the shoulder or the arm. So it's a cool muscle because it does have quite a few functions. Okay, so here we get to muscles that move the arm. So the deltoid is on this list here. So if we break down arm movements into flexion, extension, abduction, and rotation, our flexors are our coracobrachialis and our pectoralis major. Our extenders are teres major and latissimus dorsi. Our abductors are our supraspinatus and our deltoid, and then our rotators are our subscapularis, our infraspinatus, and our teres minor. And you should see these labeled on the next slide. Oh, yeah, I think we, because this is the picture from previously. So here I actually just wanted to show you, to highlight the subscapularis, because that one is part of your rotator cuff muscle, but it's not, you couldn't have seen it on the previous picture because we were looking at a posterior view. So with the subscapularis, it's sort of covering the anterior face of your scapula. So unless you get this shot sort of through the rib cage, you're not going to be able to see your subscapularis. So I want you to understand where that one is because we already looked at the supraspinatus and infraspinatus. Your coracobrachialis is an important muscle to help with flexion of the arm as well. And then we've looked at the biceps and the deltoid. So here is that image with these muscles labeled again. So I want you to again be familiar with your levator scapulae, your supraspinatus, your infraspinatus, your deltoid. So when we're talking about moving the forearm, we have again flexors, extenders, and rotators. So our flexors are our biceps brachii and our brachialis, as well as our brachioradialis muscles. Our extenders are our triceps brachii, and then the rotators are the supinator, pronators teres, and pronator quadratus. So I do want you to be familiar with your biceps brachii and your triceps brachii muscles. And here are those muscles labeled. So one thing in the next slide, we're going to see a list of the muscles that move the hand. I mentioned that there's a lot of muscles that move the hand. There's a lot of muscles in your forearm that are helping to move your hand, and that's because our hands can do such fine work that we need a lot of muscles to be able to control those fine motor movements. So I don't expect you to learn all of the muscles in the forearm, but most of them, as you're seeing just from this picture, their names either start with flexor or extensor, and we talked about how these names are helping us to understand their function, whether they're helping to flex the hand or the fingers, or are they helping to extend the hand or the fingers. And so with our forearm, we have what we call the flexor surface and the extensor surface. So if you're standing in anatomic position, the anterior surface of your forearm is the flexor surface, whereas the posterior surface, if you're standing in anatomical position, is the extensor surface. So I do want you to understand that, and that most of the muscles, if you're standing in anatomic position, most of the muscles on the anterior aspect of your forearm are going to help with flexion, whereas most of the muscles on the posterior aspect of your forearm are going to help with extension. So I do want you to understand that distinction. So let's go over the names of some of these muscles. In the flexor compartment, we have our flexor carpi radialis, flexor carpi ulnaris, palmaris longus, flexor digitorum profundus, and in our extensor compartment, we have our extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, and our extensor digitorum. So, muscles of the abdominal wall. So, first term you need to know is the linea alba, which is this tough connective tissue extending from the xiphoid process to the symphysis pubis. It serves as an attachment for certain abdominal wall muscles. So the linea alba is helping to serve as an attachment point because in our abdomen we don't have that many bones to attach to, because our abdomen is mostly soft. There's no bones there. And so the muscle wall, the abdominal muscle wall, is functioning in a slightly different way than some other parts of the body's muscles do, because when these muscles contract, they certainly help us to do things like sit up if we're laying down or certain other movements. But when these muscles contract, they're actually also pushing in and helping our organs to sort of stay inside. So it's a slightly different function than we see anywhere else in the body. Excuse me. In that it's definitely providing protection for the organs that are inside of our abdominal wall. And so if you are familiar with anyone who yourself or anyone you know having had a hernia, there's two types of hernias. One is an inguinal hernia, which happens in the inguinal region, but you can also have an umbilical or abdominal hernia, which happens when some of this muscle or connective tissue doesn't stay strong enough, and basically what happens is some of your intestines can herniate out of your abdominal wall. But obviously that's a problem, and the whole reason we have this abdominal wall is to try to prevent that kind of thing from happening. Okay, so in terms of the muscles in our abdominal wall, we have our external obliques, our internal obliques, our transverse abdominis, and our rectus abdominis. So here's a picture of these muscles labeled, and if you look at our rectus abdominis is the origin insertion points. The muscle is essentially running perpendicular to the ground, right? It's going from the head to the feet. Whereas your transverse abdominis is going perpendicular to the rectus abdominis. You can see how the muscle fibers are running perpendicular. And again, those muscles going in these different directions are helping to maintain enough strength in our abdominal wall so that our intestines and organs in our abdomen stay protected inside. So I do want you to be familiar with your rectus abdominis and your transversus abdominis. Okay, so then muscles of the pelvic floor. Our pelvic floor is made up mostly of muscles, similar to sort of the abdominal wall. We have our pelvis, but our pelvis has this big hole, and that hole is covered over by these muscles. So, if you didn't have those muscles there, all your organs would fall out through your pelvis. So these muscles are definitely serving a very important function. So we call these layers of muscles diaphragms because they are covering over that whole hole. So there's the pelvic diaphragm and the urogenital diaphragm. So the pelvic diaphragm is made up of the levator ani muscle, and then the urogenital diaphragm is made up of your superficial transversus peroneal muscle, your bulbospongiosus, and your ischiocavernosus. And here are those muscles labeled. We're not going to focus on these muscles too much right now because you will come across these again when you study the reproductive system. Okay, so muscles that move the thigh. Again, we have flexors and extenders. So in the anterior group, we have your psoas major, your iliacus. In your posterior group, you have your gluteus maximus, your gluteus medius, your gluteus minimus, your tensor fasciae lata. In your adductors, you have your adductor longus and your adductor magnus and your gracilis. So the psoas is an important one to know because it's crossing that hip. Well, let's go to the picture, the labeled picture. So you can see your psoas major is the one that's sort of crossing over your hip joint. So it's a very important one for helping us to sit up from laying down and to do anything where we need to flex or extend our hip. I also want you to know your gluteus maximus, which you're not seeing in this picture because that one's we are all pretty familiar with that one. And your sartorius, so that you can see your sartorius in this picture. It's a very, very long muscle that crosses over the anterior compartment of your thigh, so that's an important one to know. And then your rectus femoris, which we think of as our quads, part of our quads. So I want you to know your rectus femoris and your biceps femoris, which you'll see in the next slide. So these are muscles that move the legs. So your flexors, you have your hamstrings, which you're probably familiar with your hamstrings, but you may not know that those hamstring muscles are actually made up of your biceps femoris, your semitendinosus, and your semimembranosus. We looked at your sartorius already, and then in your extensor compartment you have your quadriceps, which are made up of your rectus femoris, your vastus lateralis, your vastus medialis, and your vastus intermedius. So here are those muscles labeled. I do want you to be familiar with, as we already mentioned, your sartorius, your rectus femoris. I also want you to know your biceps femoris. And then you can see in this picture your gluteus maximus. And then here you can see your semitendinosus and semimembranosus, which are also making up your hamstrings, and I also want you to be familiar with. In this picture, you're also seeing, I think you'll see it on the next slide as well, but your gastrocnemius, which is part of your calf muscle, and that's another one I want you to be familiar with. So here we have muscles that move the foot. We have your dorsal flexors, which are your tibialis anterior, your fibularis tertius, your extensor. Your plantar flexors include your gastrocnemius, your soleus, and your flexor digitorum longus. Your inverters are your tibialis posterior, and your everters are your fibularis longus. So I do want you to be familiar with your gastrocnemius and your soleus, as well as your tibialis anterior. So here are those muscles labeled. Again, your tibialis anterior muscle, that name makes quite a bit of sense, so that one shouldn't be a hard one to understand the location of. And then your gastrocnemius and your soleus are essentially the two muscles that make up your calf muscle, or what we think of as your calf. So here you're getting a better view of your tibialis anterior. And this is showing you that the gastrocnemius has these two heads to it, these two muscle bodies, even though it's one muscle. Okay, so these are the muscles. This is the list of muscles I want you to focus on. I read through all the muscles in your books just so that you have some familiarity with the pronunciation and the location of all the muscles, because, it is important to know all the muscles, but, at some point. But these are the muscles we're going to try to focus on in terms of understanding their location and trying to get a sense of how they function. So, if you know the location, it often makes sense how they function, because you'll understand, if they're on the anterior aspect or posterior aspect, it'll help you understand whether they're flexing or extending. But, I would suggest for each of these muscles, in your textbook, reading the table and looking at what it says about the function, and seeing if you're looking at a picture of the muscle and looking at the function of it, does that make sense to you? So you should, again, if you know the location, you should be able to figure out the function, but as you're learning these, it would be helpful to look at a picture at the same time that you're looking at the table that explains its function, and see if those things, and by function, your table actually says action, so same thing, action or function. See if those things make sense to you. The muscles that I want you to memorize the insertion and origin of are, I'm going to put stars by. So your sternocleidomastoid, your biceps brachii, and your gastrocnemius. So again, that's just to give you a sense of these muscles are, ones that you should definitely be familiar with, and their origin insertions points. I think learning them will help you to understand some of these major joints in the body, namely your knee and then your shoulder. Okay, so the next couple slides are going to show you all the muscles in the body, and then all the tables with the origin, insertion, and actions of the muscles. You can see these things in your book as well, but I did add them to this PowerPoint. But since we're essentially out of time, I'm just going to flip through them. And I will be posting the PowerPoints as PowerPoints as well, so that you can study from them. So that's all for Chapter 8. It's a lot of material, so like I said, it may be worthwhile. You may end up watching that first PowerPoint again, but definitely review the material in your book and see what questions you have. So we'll spend part of your next lecture just going over any questions that you have. So definitely formulate a list of questions of things that you are not quite clear on if this chapter was challenging for you. Okay, I'll see you next week.